Now, you are the head of the Epidemiology and Global Health Division at the National Institute of Biomedical Research in the DRC, which is, of course, the epicentre of this outbreak. How does this outbreak, in your opinion, compare to past outbreaks of Mpox?
Thank you so much, Anna, for this opportunity to talk to people regarding Mpox. So I think the current outbreak is really important compared to the past outbreak, as we see a huge increased number of cases since 2023. And also with the new dynamic of transmission that we are seeing, we knew that Mpox was a zoonotic disease, so most animal to human transmission and less human to human transmission. And now we are seeing kind of sustained human-to-human transmission, and even with subclade that can be transmitted through sexual activities.
And how deadly is Mpox for those who contract it compared to, say, COVID-19?
Now, I can say that the global mortality of Mpox in the DRC is about 3.5, 3.6%. So, and I can say the burden is mostly among children under 15, and also we see some comorbidities in children under 10 or under 5, for example. Yeah, that can lead to severe cases. Yeah. And
how effective is the vaccine in combating this latest strain of Mpox we've been reading so much about, the Clade 1b variant that was detected, first case of which was detected in Sweden just 5 days ago? How effective is the vaccine in combating this strain, this latest strain of Mpox?
For the moment, we don't know exactly how effective can be the vaccine. We know that the vaccine can provide a good immunogenicity, but there is no, in my knowledge, a study done to assess the effectiveness of efficacy of the vaccine in our context. So we don't know, but we suppose that as the vaccine was designed for the Mpox in general, it should be effective against also the Clade 1b. But as I can say, we are not sure it's 100%.
And what then are the main challenges when it comes to vaccine access in Africa? And also, crucially, how much enthusiasm is there among the general population for a new Mpox vaccine?
I think the challenge is first the number of doses available. I think for the whole continent, we estimate about maybe 10 million of vaccine doses, but it seems like in the pipeline there are maybe around like 500,000 doses that could be available through donation from partners and so on. So we think that it's not enough, and we need to work more, and the countries need to also be really involved to see how we can get more vaccine for the population. As we know that after the cessation of smallpox vaccination, all people born after this cessation, the cessation of smallpox vaccination are susceptible to get this Mpox. So we need, as we are working to prevent and get the vaccine, but we need also to see how we can also improve case management.
Placide Mbaia, Associate Professor at the University of Kinshasa School of Medicine, thank you so much for speaking to us today.